Today I'm joined by Michael Johnson, CEO from Rhinomed. Michael, welcome back to the Morgans Network.
Thanks, Scott.
Regular contributor to the group.
Trying.
You joined back in 2013
Yep.
to turn around the business. It's come a long way. What's happened recently that's really got everybody excited? The share price has basically tripled, from its time 6 months ago.
So I guess I think what's really exciting is that when I joined in 2013, we set out a strategy of basically proving that we had a platform that we thought had utility in sport, in sleep, and then drug delivery. And I guess what we've just announced is the Columbia Care medical cannabis deal, where Columbia Care have agreed to license our platform for use of nasal drug delivery of medical cannabis in the US, which is I think a sort of combination of all the hard work that we've been putting into the company for the last 5 years, and really demonstrates that the platform does have utility across a wide range of uses, and medical cannabis being a massive market. In this particular case, we have a platform that actually solves some significant issues.
So you keep using the terminology platform, and I know in a lot of your marketing and stock market releases, you talk about the platform.
Yeah.
So maybe just sort of describe that again.
Yeah.
And the base business is snoring, I guess.
Yeah. So we have a platform that goes inside the nose.
Yeah.
So it's a device that goes in the nose, and it's a stent, in effect, like the stents have been around for a while. So we have a platform, and it's a platform in the sense it's also protected. So we've got 60 patents, both granted and pending, that look at the utility. And our core business, the core consumer health business, is really a inert stent, just something that goes in the nose, opens up the nose, allows you to breathe better, and it's targeting snoring. So we have a product called Mute, which is on market. It's in 9,000 stores in the US, 11,000 stores globally. That is actually designed to stop people snoring, and it's doing that very successfully. And we've managed to generate really strong revenues in a very short period of time. We've just done 2.1 million off the last financial year, off about 4,300 stores. And off the success of that program, we've managed to be able to pitch to some key players in the US, CVS and Rite Aid, and they've taken us on. And from that, we've grown our store presence significantly. What that does is socialise people with the idea that you can use the platform. And from that, we've also now seen interest from other companies like Columbia Care, who have said, people are using your platform, can we put a medical cannabis on it? And the answer is, of course, yes. And that's what we're now working on to deliver.
I know you're doing some very interesting work in sleep apnea.
Yeah. So what's interesting about the sleep apnea market is that, as for those who are familiar with ResMed and SomnoMed, two of the key leaders, Philips Respironics, have the CPAP mask. One of the key challenges for those technologies is that if you've got any form of nasal obstruction, with a mask, you struggle to breathe. And the answer to that is they crank up the pressure, and that can become quite uncomfortable. Of course, compliance suffers. So what we're seeing a lot of sleep specialists do in America in particular, and Australia here as well, is actually use the Mute as a companion piece. So that's something that has really emerged probably in the last 3 years as we've launched Mute, is that we've seen this adoption of Mute as a solution to nasal obstruction. And the same with an oral device. If you've got an oral device in your mouth where you've basically, in effect, got a mouthful of plastic, if you've got any form of nasal obstruction, well, then you're really going to struggle to actually be able to breathe at all. So once again, Mute solves that nasal obstruction issue. So that's something that we're pretty excited about, because it's really shown that Mute is a frontline solution to nasal obstruction in sleep apnea. What's exciting about the Columbia Care deal in particular is a study that came out of Northwestern University earlier this year that was reported in the journal Sleep, that showed that you could actually give a patient a synthetic cannabinoid, a drug called dronabinol, which is a generic, a synthetic THC, and lower the apnea-hypopnea index. And that's the first time, to our knowledge anyway, that somebody's been able to actually use a drug to actually reduce apnea-hypopnea index, in effect, treat their obstructive sleep apnea. So we certainly think that we can actually look at the sleep apnea market with a drug-device combination that will actually target the vast majority of people who don't actually want to wear a mask, don't want to wear an oral device, with a low-invasive, low-cost, better alternative. And that's disruptive and really exciting.
That sounds very disruptive. Thinking about the next 12 months, from an investment point of view, what can we look forward to?
A couple of key things. We've had 6 consecutive quarters of growth. We expect to see that continue. So organically, we're growing. We've doubled our store count in the US, as I mentioned earlier, over the last 12 months, and we expect to see that revenue come online in Q2, Q3, Q4 of this financial year. So we expect to see solid, steady growth in our business out of America. We're looking to expand our presence here in Australia. We're in Boots in the UK, and we certainly expect to see some growth, further store growth out of the UK. So there's that organic business that we certainly think is going to grow. The other exciting things is that we've always spoken about adding new products to our range. We're working on a decongestant. We've just finished pitching that to our retailers in the US. So we hopefully see that flow through into the US market in 2019. And we've also got a sleep product as well, which is similar to a decongestant in the sense it's an essential oil formulation, and we expect to see that come through onto the stores of US distribution channels. So a widening of our portfolio of products, and then ultimately, I guess what we're all looking forward to seeing is the first range of products in the medical cannabis space coming to market in the biggest medical cannabis market in the world, which is the USA. I mean, it dwarfs every other market in this space by a huge quantum, and in our minds, it's the only market to play in at this stage. So we're very excited that we've got a credible partner, the biggest and most experienced operator in the US. They do all the way from growth all the way through to the manufacturing and then dispensaries as well. So they're through the chain, value chain sort of position, and they're huge. So we've got I think the best product, the best partner, and we're looking forward to some, hopefully some really good revenues down the track.
Very exciting. I mentioned that the share price has tripled since we last spoke, and I know you've built a very strong register.
Yeah.
So again, perhaps just tell us who your key investors are.
Yeah, so we've got, I think the top 20 now have got a little over 50% of the company in terms of the register. It's anchored by our chairman, Ron Dewhurst, who's ex-Legg Mason, ex-JP Morgan out of New York. He's got about, I think, 7 to 8%. John McBain, one of the founders of Melbourne IVF, of course, has got about, I think, 6.5%. And then our two largest shareholders are both Americans. Paul Stevens, who ran Robertson Stevens in San Francisco, a key player in the West Coast A-rounder in Twitter and Uber. Sons run Blockchain Capital. He's got about 8%. And then Whitney George, who runs the Sprott Asset Management Company, which is a multi-billion-dollar fund out of New York. He's got 20% of the company. So we've got some really solid, high-quality investors who have really, I think, understood, and like you, Scott, have identified the opportunity early on and really cemented in some really nice positions. And that really firms up the register where we've got high-quality, strategic, long-term investors on board, which is great.
Well, it sounds like a very interesting year ahead for Rhinomed. I've been joined by Michael Johnson, who's the CEO of Rhinomed.